Thank you, Mr. President. Just a couple of things, and then I just want to make a comment about something that happened yesterday. You're going to hear from Dr. Birx soon about the numbers that we've been talking about, how things are starting to balance off. And I think the more as we go by each day, I think we're going to see, and again, I never like to get ahead of myself or of Dr. Birx, but it looks like even though we've had a really bad week last week, remember when I was speaking to you before, I was saying this was really a bad week. There's still going to be a lot of deaths, but we're starting to see in some areas now that kind of flattening, particularly in a place that was a hot spot like New York. That's the first thing. The second thing is that I had a really very, very productive conversation with the Congressional Black Caucus this morning for about an hour, and they really wanted to know what exactly are we going to be doing in the immediate as well as the long range about the health disparities and the discrepancies both in infection and in poor outcome in the minorities in general, but specifically African American. And I mean, I made it very clear to them that what we have to do is focus on getting the resources where the vulnerable are to be able to get testing done, to be able to get the appropriate identification where proper and where appropriate to isolate and contact trace if we can, but also to help mitigate in a community that is suffering and suffering much more disproportionately. So I just wanted to get that out of the way. The other point I wanted to make is that I had an interview yesterday that I was asked a hypothetical question. And hypothetical questions sometimes can get you into some difficulty because it's what would have or could have. The nature of the hypothetical question was if, in fact, we had mitigated earlier, could lives have been saved? And the answer to my question was, as I always do, and I'm doing right now, perfectly honestly, say, yes. I mean, obviously, if mitigation helps, I've been up here many times telling you that mitigation works. So if mitigation works, and you instigate it and you initiate it earlier, you will probably have saved more lives. If you initiated it later, you probably would have lost more lives. You initiated at a certain time. That was taken as a way that maybe somehow something was at fault here. So let me tell you from my experience, and I can only speak from my own experience, is that we had been talking before any meetings that we had about the pros and the cons, the effectiveness or not of strong mitigations. So discussions were going on mostly among the medical people about what that would mean. The first and only time that Dr. Birx and I went in and formally made a recommendation to the president to actually have a, quote, shutdown in the sense of not really shutdown, but to really have strong mitigation. We discussed it. Obviously, there would be concern by some that, in fact, that might have some negative consequences. Nonetheless, the president listened to the recommendation and went to the mitigation. The next second time that I went with Dr. Birx into the president and said, 15 days are not enough. We need to go 30 days. Obviously, there were people who had a problem with that because of the potential secondary effects. Nonetheless, at that time, the president went with the health recommendations, and we extended it another 30 days. So I can only tell you what I know and what my recommendations were. But clearly, as happens all the time, there were interpretations of that response to a hypothetical question that I just thought it would be very nice for me to clarify because I didn't have the chance to clarify. Thank you.
The date on that.
Excuse me?
The date.
You know, to be honest with you, I don't even remember what the date was. But I can just tell you the first and only time that I went in and said we should do mitigation strongly, the response was, yes, we'll do it.
And what did he do? Is that the travel restrictions?
No, the travel restriction is separate. That was whether or not we wanted to go into a mitigation stage of 15 days of mitigation. The travel was another recommendation when we went in and said we probably should be doing that, and the answer was yes. And then another time was we should do it with Europe, and the answer was yes. And the next time we should do it with the UK, and the answer was yes.
In this interview, you said there was pushback.
Yeah.
Where did that pushback come from?
No, it wasn't, and that was the wrong choice of words. You know what it was? When people discuss, not necessarily in front of the president, when people discuss, they say, well, you know, this is going to have maybe a harmful effect on this or on that. So it was a poor choice of words. There wasn't anybody saying, no, you shouldn't do that.
Are you doing this voluntarily, or did the
No,
president?
I'm doing
or
it. Everything I do is voluntarily, please. Don't even imply that.
Thank you, Mr. President and Mr. Vice President. As you announced, we are very pleased that we are ahead of schedule on delivering the economic impact payments. These were what was known as the checks in the mail that we want to deliver in direct deposit. This is ahead of schedule. We started processing those last Friday. We expect that over 80 million hardworking Americans will get the direct deposit by this Wednesday. And we know how important that is to all of those hardworking Americans, many of which are at home not working at the moment. If you do not receive them by Wednesday, on Wednesday we will be launching at irs.gov. Click on irs.gov, go to Get Your Payment. If you filed a tax return in 2018 and 19 or 19, have that information available. You'll be able to ID yourself. You'll be able to put in your direct deposit information, and within several days, we will automatically deposit the money into your account. We want to do as much of this electronically as we can. It's very important in this day and age. It's more secure, and you don't have to go to the bank. If you are a Social Security beneficiary, you do not need to do anything. You will get a direct deposit. If you have not filed and did not need to file a 2018 and 19 return, you can go to irs.gov now and enter your information and authenticate yourself. So again, we are very pleased that that is ahead of schedule. I'd also like to announce the progress we're making on the new SBA program, the PPP. Let me just remind everybody, this is a brand new program that is now 1 week old. We have distributed and confirmed $230 billion of loans to over 4,600 lenders participating. That is multiples and multiples of anything that the SBA has ever done in 1 year before. And I especially want to thank the broad-based community banks that are participating. Again, over 4,600 banks. If you haven't had your loan processed, you will get it processed this week. As the president said, we've gone back to Congress and asked them for more money to make sure that every business has access to this. Let me also comment for the states. We are distributing out half the money this week to the states. That's a week ahead of time. And we'll deliver the other half of the money to the states next week. And then let me just finally comment, we've been working very closely with the Federal Reserve. Last week we announced expanded facilities and new facilities that total $2.3 trillion of liquidity. And in particular, I'd just like to highlight a Main Street lending facility that will be for companies between 1 worker and 10,000 people, so mid-sized businesses, and also a municipal facility for states and local governments to be able to access funds given the shortages that they have.
Secretary Mnuchin. Thank you, sir. Both Speaker Pelosi and Minority Leader Schumer have said that they're in negotiations with you right now on additional funding for these small business loans, that package. Leader McConnell, though, has said that nothing should be added to the package, that it should just be specific to small business loans. What is the opinion of your administration? Should there be some sort of horse trading here, or should it just be small business loans?
Well, the president's view and the vice president's, in my view, is this was a bipartisan program. This SBA program, it wasn't a Republican program, it wasn't a Democrat program, it was a bipartisan program. We've committed to small businesses. We should top up that program now. I know the Democrats want to talk about more money for hospitals and states. Right now, we're just sending the money out to the hospitals and states. They haven't come close to using that money. And I know the president and vice president have said, once we get the SBA done, we can go into another funding bill. The president's talked about potentially adding infrastructure and other things. We think there is a likelihood we will need more money, and we will sit down and try to get a bipartisan bill. But this is important we deliver on small businesses. 50% of the people work for small businesses.
Thank you, sir.
What's the emergency that the president said you had to go for? The president said you had an emergency.
Negotiation.
Over this bill?
Yeah, well, because we don't want to run out of money. We've used about $220 billion of the $350 billion. We don't want to run out of that money. We don't want to create panics that people won't get it. So That's why we want to top that up, and we've asked for another $250 billion for that program. And again, let me just remind you, every dollar we spend in this program, we save $1 of unemployment insurance. So even though we're asking for $250 billion, it really won't cost that much.
Could I follow up?
Do you have concerns about lifting the guidelines too soon? I mean, what's the economic impact? I understand the economic argument for getting people back to work, obviously, but what's the economic risk of lifting them too early and seeing then a spike in cases
Well,
again?
of course, there's economic risks in both directions. We reviewed with the president today a very broad list of over 100 business people that are going to help advise the president on what needs to be done to reopen the economy. We want to make sure, and again, the combination of economic impact payments, small business payments, enhanced unemployment insurance, the president made very clear we want to make sure that hardworking Americans have liquidity while we wait to reopen the government.
So do you believe the government should be reopened, or the country, excuse me, should be reopened on May 1?
I've had discussions with the president. I know he's considering it, and I believe he's going to make a decision later in the
What
week.
is your advice to the president?
My advice is as soon as it's ready to open and based upon the medical professionals, and again, we're working very closely with the president and outside business leaders to develop a plan.
Has everybody that you would like to have, the 100 business people on the Economic Council, have they all been invited already? Have they all agreed to
They
it?
haven't been invited yet. We just reviewed the names with the president today for him
And
to
are they
sign
from all
off.
sectors,
Yes,
energy?
basically there's verticals, so every single area of the economy we wanted to be represented.
Great. One other thing, is there anything else needs to be done to work on industry, oil industry jobs, to save oil industry jobs after the deal this past weekend?
Well, I think there's always things. So we're working with Larry Kudlow. I mean, we have
Specifically that needs to be done?
economic plans for every single part of the economy. Obviously, in the case of the oil industry, they've been hit especially hard because you've had both the supply issue and you've had the demand issue.
Have you figured out the bailout money for the airlines, what the allocations for the airlines?
So I'm pleased to say we've worked very hard. I think, as you probably have seen, we put out a press release that we have now had discussions with almost all the airlines. I've personally had discussions with all the major airline CEOs. We specifically created an exception for small airlines that we could process very quickly, and I think you'll see very quickly decisions coming out. I'm very pleased with the discussions we've had. Let me just
Do you
comment.
still
I'm gonna
see
answer
a
your
need for a
question.
phase 4? Is this push in lieu of another stimulus?
Okay, so again, let me just comment. I mean, Congress, on a bipartisan basis, approved an unprecedented amount of money to help American workers and American business because it was no fault of their own that business was closed down. We have been very diligently executing on that. You know, everybody said it was going to take months to get people money. We are executing very quickly. We created a whole new SBA program in a week. Our job right now is to execute the $2.3 billion, which we can add several $1 trillion with the Fed. The one area we are particularly concerned about is the small business program. Quite frankly, it's even more incredibly popular and successful than we anticipated. So the president wants to be very clear we have money for that. And once we get done with that, we will review with the president. If there is more money that needs to be to support this economy, to support hardworking Americans, we will work with Congress to get that. So phase 4, the president has talked about infrastructure for a long period of time. We've talked about, to the extent that the hospitals need more money because of the medical issues, we'll monitor that. We want to make sure there are incentives for restaurants, entertainment, people to get back to those types of things. So we'll be looking at very specifically provisions to stimulate parts of the economy. Some of them may be money issues, some of them may be regulatory issues.
A question from one of my colleagues who's not able to be in the room. They're curious about the SBA rule that prevents small casinos from getting some of this relief. Is that something that you're taking a look at? Is there going to be a change to
So
that?
not small casinos, but there are such things as small taverns and restaurants that have literally, you know, small gaming things, and we are coming out with some additional guidance on that. But I want to be clear, it's not small casinos.
Thanks, sir.
Secretary Mnuchin?
Secretary,
Yes.
there was a letter that some House Republicans sent this weekend about liquidity for mortgage servicers.
Yes.
Can you explain what you're looking at on that front?
Sure. So I think I commented on this a week or so ago, we had a subcommittee task force at FSOC that specifically studied this issue. We have all the appropriate people on it. Ginnie Mae has automatically taken some action. We've had conversations with the FHFA as to what they're going to do for Fannie and Freddie, and we've said that to the extent they need certain authorities from the Treasury, we will accommodate that. So we're very aware of the issue. Quite frankly, we'd been studying this issue way before COVID and had concerns about some of these non-bank servicers not being well capitalized, but we're going to make sure that the market functions properly.
Thank you, sir. We have seen in a number of these relief bills that Democrats and Republicans have been able to push forward different non-coronavirus specific funding priorities. Are you trying to keep funding specific to coronavirus? And then if there are going to be other additions, for instance, a change to labor rules is something that many on the left wanted. Some on the right are wondering if they should also, if you should also be pushing for, their preferred add-ons.
Well, I think our expectation has always been this is COVID related. Some people have a rather broad view of what COVID related is because it has impacted almost every single business. I think the president has talked about the Kennedy Center, which is a good institution. Obviously, that was not the major priority of the bill, but they were hit with COVID related. But no, the president has instructed, we want to be very specific in the next bill. It's COVID related items.
It's been reported that you argued at the time of the China ban was being discussed, that was too disruptive to the global economy. Is that accurate?
Okay, let me be clear. I had nothing to do with the China ban. I wasn't on the task force at the time. I'm not even sure I think I was traveling at the time, but I never had any, I was not part. I did become very active and after the China ban, but that report in the New York Times was not accurate. I was not part of the task force at that time, and I was not involved. Matter of fact, I think I may have been traveling.
This is a proposal by Senator Hawley to get direct payments to employers to pay people who have been laid off and to keep people on payroll. Does the administration support that proposal?
Well, again, that is the PPP. The PPP is basically sending money to small business, 50% of American workers, to keep those people paid. And it's the most efficient way. Every dollar, as I said, we do through that, it's one less dollar of unemployment. And more importantly, we want those people to be associated with the business, so as soon as the president is ready to open up the economy, those businesses are together. We don't want those businesses to fall apart. That's why this is such a successful program.
But are
and
you
we want
talking about
Congress to remember
unemployment?
some of them are, and some of the states aren't, and we encourage, we're working with the states to try to update their computers, but it's a long haul.
Great. Thank you, Mr. Vice President. I don't know if we can get the first slide on cumulative cases. Yes, thank you so much. I wanted to show you a different way of looking at it today. Obviously, we look at case counts per 100,000 Americans in each of our states and metro areas. But I wanted you to see in absolute numbers how much the New York, New Jersey metro area dwarfs all other metro areas. And so you can't even see Chicago, Detroit, or Boston. All of those metro areas are under 25,000 cases. You can see that the New York, New Jersey metro area is about almost 250,000 when you bring those cases together, almost a log more. And that's why you hear us talking a lot about the metro area of New York and New Jersey and the counties of Rockland and Westchester and Suffolk and Nassau and Bergen, New Jersey, and why we're so focused on getting resources to that metro area. If I can see the next slide then. So if I take New York and New Jersey metro area out, this is the other metro areas that we have been tracking very closely. I wanted to show this to you so you could see how those curves are already starting to plateau. So if you look at Detroit, if you look at Philadelphia, if you look at Louisiana, Louisiana's in green, Detroit is in gray. You can see across the board, across these metro areas with have a higher concentration of individuals. This is what the American people in these large cities have done, where it is more difficult often to socially distant. And we're just really impressed by the work of the mayors and the governors to make this happen. I also wanted you to see this because you can clearly see Chicago and Boston. And so Chicago is in the orange and Boston is in the yellow. They're crossing Detroit. And that's why we have been very much focused on the needs of those areas. And there's one, and Providence is also in that category. It's difficult for you to see them because they're much further down on the slide. But the highest, if you look at the axis on this slide, it's 25,000. The axis on the last slide was 300,000. And so that's why I really want people to understand each of these epidemics, small epidemics in each of the metro areas, we're tracking independently, as well as any epidemics and outbreaks that are happening in some of our other states. So I just wanted you to have that perspective of how significant the New York, New Jersey issue is and why we've been tracking that so closely. But I also wanted to assure all the other states that we're tracking them also very closely and really working with the governors and mayors. And that's why I wanted to see that not only are the curves flattening in some of those major metropolitan areas, but they're starting to decrease. And this is what we're very excited about. These are cases. We also know that mortality will lag. And so we're really tracking also the number of individuals who have succumbed to the COVID-19. I also wanted to really note here that, yes, our mortality is less when you combine European countries equal to the size of the United States. And I think this is really two things. One, it's the incredible work of the American people, that it's also the incredible work of our healthcare providers and the system of each of these hospitals that have the resources and the ability to respond to the needs of the COVID-19 patients. And I think you can really see the superb healthcare delivery that is happening by the low mortality. Just to mention really quickly about testing, because you've heard me before talk about it, and then it was a little bit misquoted and misaligned, but there are multiple Abbott machines, so I'm going to be very clear, having spent years in the laboratory. The high throughput machines, which are the Roche 6800 and the 8800 on Roche, and the Abbott M2000, these are the machines that run between 500 and 1,000 assays at a time. The Abbott company worked really hard 3 weeks ago in getting 1 million tests out there to be utilized, and they can make 1 million tests a week for all of our laboratories that have these platforms. And so far to date, somewhere around 250,000 tests have been utilized in 3 weeks worth of work. And that's why we've really been appealing to the laboratory directors to really bring all those machines on. Last week, Dr. Fauci and his incredible team of researchers have agreed to really reach out and find additional Roche and Abbott high throughput machines that are in research institutions and doing critical research work, to bring them online also, to supplement the other laboratories' work, to create a mosaic and a complete strategy that brings together the high throughput platforms with the medium throughput platforms, with what are the low throughput but rapid platforms, which is this ID Now. ID Now is not going to be the answer to the number of tests that we need over the next few weeks. Those run a test every 15 minutes. And we can get about 55,000 cartridges a day. But I just got done saying that these other machines, of which we have hundreds of, can run 500 to 1,000 in a single time frame. And so we need to bring all of these assays together, and a team has been created to call every single laboratory and every single research institution across the United States to define the complete capacity in every single state, because it shouldn't be our expectation that every governor understands exactly everything that's in his state. But we have to understand everything in every state in order to be able to meet the needs of the American people as we increase testing. Now, I know you all know that in 3 weeks we went from 300,000 tests total to 3 million tests total in 3 weeks. We know that we have to further increase that. That has been done really by HHS and Admiral Giroir and the team up there. And we're going to supplement that team to really bring on all of the additional resources and platforms that we have in the United States of America, just like we did with ventilators, to bring all of the capacity to bear so that we can also continue to increase testing. Also, of course, as these epidemics decrease, you can also be able to use more and more testing for surveillance. But I do want to call out the 19 states that aren't ever represented in these graphics, and by and large. The states have been continuing to do containment and outbreak investigation. And I've been able to talk to many of those states, and I would just remind all of us, when I talk to each one of these state health officials, where they are finding outbreaks are in nursing homes. And so we really need to continue to protect and we continue to test in nursing homes, because we know that that's a particularly vulnerable group. And it's a group where often, now that we're beginning to understand asymptomatic transmission, no one is intending to pass the virus on to others. But we know in essential workers around the United States, people are unknowingly infected and in passing the virus on. And so those are the ones that we're very interested in finding. And you might say, well, how do you find them? Because they don't have symptoms. And so this is where we really have to increase surveillance in a very deliberative and understand way. And so we're really looking, what are sentinel surveillance sites? I think we can see where there's outbreaks, because once people have symptoms, you can see them. But where do you do sentinel surveillance so that you find them before they have symptoms? This is what we have done for decades in HIV, and it's what's allowing us right now to really control the HIV/AIDS epidemic in sub-Saharan Africa, because we're finding people when they're asymptomatic and treating them when they're asymptomatic. So this is something we know how to do, and it's something we're working very closely with CDC and others on to make sure that we can bring that full capacity to the American people. So these are just some insights in what we're working on. We're continuing, obviously, to track every single county and community. And then finally, I'm going to call on one additional group. There's a group out there of our HIV/AIDS activists and community workers that understand these tests that I've been talking about, these RNA-based tests, because they often get viral loads in HIV. They will know how to explain this to the community about sampling and what it means to run those assays. They are essentially virologists. They understand all of these assays. They'll also understand the antibody assays, because it's the antibody assays that they counsel and utilize in HIV testing across the United States. And they will be our translator to the American public and to their local mayors. They understand these tests. They are essentially understand all the virology and all the immunology. And I'm really asking all of them to help us communicate what these tests are so the community is ready for them. Because antibody tests measure something very different than the viral load in the front of your nose that we're using for diagnosis. And so really being able to understand all of those tests, when to use them, how to use them, will be really critical. But the great thing is, in the United States of America, we have these community groups that understand these tests very well and will be able to discuss them at every level with their community.
I just want to make one comment that related to a question that was asked, and then we'll have questions. I don't want to take too much time. The idea about how we would evaluate from a purely public health standpoint about what I call reentry into some sort of normality. As health people, I don't know anything about, nor do I have a claim to know anything about economics. There are going to be people who know a lot more than I do who are going to give advice about all of the committees that the president was talking about. But the one thing we do know as health people, as physicians and scientists and public health people, as I mentioned, I think over the weekend on one of the shows, is that some people may think it's going to be like a light switch, on and off. You know, we're either out and we're in. It's just not going to be that way, because we have a very large country, and there are different impacts. As you see, New York is very different from other parts of the country, from the Midwest, from the mountain region. California and Washington, different than New Orleans. So as we discuss and consider the public health aspects, it likely would be something that I refer to as sort of like a rolling reentry. It's not going to be one size fits all. So I don't know what it's going to be yet because we still have time to look at it. Dr. Birx, who does an amazing job with showing you the data and the charts, that's going to likely influence some of the recommendations that we will make. But I can assure you, they will be recommendations that will be based purely on public health. And the president will get a lot of other input from others, but we'll give the honest public health recommendation.
Thank you, Mr. Vice President. Can I have the ventilator slide back up? Or just start from there? All right, thank you. So you start with what's in the stockpile this morning, and then here's the contracts that we'll be delivering over the next few weeks. We add 8,600 ventilators to the pool we already have. That's the math that you get there. That's included the DPA action with GM, and I will say that we've also issued what would be called rated orders with all of these vendors to allow them front of the line privileges, so to speak, within their supply chain. So we've written the contract. This is the 100,000 plus ventilators we're talking about, and to continue to work with them to ensure that the ventilators actually show up. So there's a continue to work there. And as we did that, we realized that downstream supply chains needed some additional Defense Production Act work as well. You go to the air bridge. 80 flights scheduled, 37 complete, 43 on the horizon, and you can see the numbers of material that's been brought in to supplement the volume that's needed. Now I'm going to go through a series of slides of New York first. So Dr. Birx provides me what I will call as a geographic reference to align the supply chain. So all of those cities, you'll see a little bit of theme here. I'll be talking about a lot of the cities and geographic areas. Align the supply chain to those geographic areas to try to get as much there, while realize the rest of the nation needs supplies as well. And then we aligned the supply chain to site of care, public hospitals, VA, private hospitals, nursing homes, first responders, acute care, and on down the line. So the last business week, so Monday of last week through Friday, Saturday of the past week, these are the amounts of materials that came into the New York, New Jersey metro area, and you can see the volumes there. So if you can go to Detroit, we talked about their hotspot. Here's the volumes of deliveries going into Detroit for that same time period. If you can go to Chicago, and I'm going to run through this kind of quick, but you can see that the geographic alignment, the places that Dr. Birx has talked about is where we're concentrating supplies. If you can go to New Orleans to give you an understanding. Washington, D.C. Right, so I hadn't talked about that. Today was, a very kind of early entry into the, Washington, D.C., Baltimore, right? Positioning supplies ahead of need, we hope, in Washington. Go to Baltimore, and you can see the volumes there, trying to get ahead of that. And then Philadelphia is next. And then now the next slide is a 9-city roll-up. And so to save a little time, I did not include Boston and Houston in there. So you can see the volume of material flowing through a commercial network, air bridge, their supplies, into geographic regions, and then further prioritized to site of care. Now, final topic. N95 masks. So the Department of Defense announced a DPA action this weekend. That came over from DOD on Friday into the White House, approved on Saturday, and contract awarded today, $131 million, 5 companies, 3M, Honeywell, Owens & Minor, Moldex, and Draeger. The CARES Act was signed before March was end, right towards the end there. So essentially, 2 weeks from that money being put in the title 3 authority for DoD. This action takes us from a baseline of what was being produced domestically of about 30 million masks, upwards to, as we go through the fall into the winter, 120 million masks domestically. So currently, we're filling some of that demand from overseas sources, right? And so the additive masks here through this will ramp up, lower dependence on overseas sources, and that will essentially secure a big piece of supply chain. 5 companies, 6 cities, Smithfield, Rhode Island, Phoenix, Arizona, Del Rio, Texas, Lexington, North Carolina, Sheboygan Falls, Wisconsin, and Aberdeen, North Dakota, all either producing more fabric or increasing production facilities to have that ramp up.
Thank you so much. One for the Admiral and then one for Dr. Fauci, if you don't
please.
mind. For the Admiral, wouldn't it have been useful as you're going through, all of those supplies that are now making their way into the system? You talked about having to buy foreign products, as we're catching up and making it. Wouldn't it have been useful if it had taken until mid-March for the government to start placing bulk orders for these kinds of supplies?
So I came over from the Pentagon the 20th of March, so I'll speak from the 20th of March on now. We're using the Defense Production Act. I think you'll see much more use of that as we go forward. We make.
My question is about the timing here and
I
that
know
lost
that.
time that the president
I'm not equipped to
denied.
talk about other than from about the 20th of March forward. I was over the Joint Staff. I wasn't involved.
Ask Dr. Fauci. You said that you'd be, giving the president your recommendations, you and Dr. Birx coming up with a plan that you guys are comfortable with. Are you willing, once the president has made his decision, are you willing to come here and tell the American public what you actually had recommended to him and whether he followed through with what you recommended?
I'm not really, what do you mean? Like,
So when the president stands up here, whether it's, May 1st, whatever day it is, and outlines his plan, are you willing to stand up here after him and tell the American public what it was that you had recommended he do if there is a difference?
I have to think about that because, when you have conversations with the president, sometimes they really should be confidential in what you give him because he's going to have to make his own choice. I'll have to think about that.
So that way we would know whether he was actually listening to the health advice that he's being provided.
Yeah, he is. I mean, I can tell you one thing, he'll listen. But I think what's going to happen, I don't know for sure, is that he will get input from a number of individuals representing a number of aspects of society. One of them will be a health. The only thing that I can tell you is that I will give him the advice based on evidence, my observation of what the best public health approach would be.
Dr. Fauci?
Yeah.
Just to go back to where we started today, which was with the president's seeming frustrations with some of the reporting about his early decision-making process in January and February. As I'm sure you know, the reason we in the press do that kind of reporting is so that the next president that comes along and has to deal with the pandemic learns some of those lessons. Having watched this unfold up close, what do you think were the mistakes that were made early on that a future president could learn from, with the benefit of hindsight, of course?
There's
no president gets
Yeah.
it right, obviously.
I understand. I don't want to use the word mistakes because when you're in the fog of war, when you're doing something, you have to make decisions. You get input from a number of individuals. It's always a moving target. And I just don't want to have anything taken out of context because I already had one of those already in the last couple of days. So I don't want to go through it again. I wouldn't say mistake. Could things have done better? Of course. I mean, nothing is perfect, and you could always do better. But I mean, I hesitate to say something is a mistake.
With the benefit of hindsight, with that caveat, what could have been done better?
Well, I mean, I can't comment about anything outside of my own field, but the thing that when I think back on was evolving in my mind was something that was a virus that was much worse than what I had thought it was going to be, based on what we had learned early on, when it was first felt to be something that just jumped from an animal to a human, and really didn't have much capability of going human to human. And then all of a sudden you find out that not only was it not just animal to human, but there were a lot of, that's probably the way it started. But then as you go back and you realize there were probably a lot of infections that maybe if we had dealt into that a little bit more, we could have learned that not only is it affecting human to human, but it's transmitting really efficiently. When I question myself, I'm not perfect. Maybe I wouldn't say made mistakes, but maybe I should have really tried to delve into that a little bit more about what was going on, but the information wasn't as forthcoming as I would have liked. And then all of a sudden, when you find out that you're dealing with something that is not only what had been your worst nightmare, because people ask me that, what is your worst nightmare? A brand new virus that's respiratory transmitted, that has a high degree of transmissibility, that has a high degree of morbidity and mortality. You know, is that a mistake? Maybe I should have been able to realize that earlier. I'm not sure it's a mistake. It was just an evolving thing that we finally realized and said, whoa, this is really worse than we could have imagined.
Question for the
All right, last one, guys.
How about one more?
When you met with Abbott Laboratories today, what did you ask them to do? What did they say they could do?
Well, we spoke with Abbott Laboratories today about how we can increase significantly the production of cartridges for the 15-minute test. Because remember, we're not only scaling to rapidly expand testing across the country today, and it's one of the reasons why you heard me and Dr. Birx say that we have an entire team now that's going to be working with governors and with laboratories around the country to identify the machines that already exist today and that could be activated and doing tests. But we also want to work with Abbott Laboratories for the longer term, because if the current trend lines hold, and I hope and I literally pray that we will soon find ourselves on the downslope of the coronavirus in this country. This epidemic in its current form will come to an end, but as we make decisions and in the days ahead to reopen America, what President Trump also wants to do is have a policy in place to stay open, and having the kind of surveillance testing available around the country so that CDC can do the immediate contact tracing when you have a positive test, so that we can deploy resources like the new Abbott 15-minute test specifically to nursing homes. We spoke today to Governor Baker in Massachusetts, Governor Hogan in Maryland, both of whom have been very innovative implementing federal guidelines for preventing the spread of infectious disease at nursing homes, and we commend them for that. But being able to increase the manufacture of those devices so they can be deployed going forward in the months ahead is also a focal point of our efforts. So rapidly continuing to expand testing today. The governor of Louisiana told me today that they had tested at the highest per capita, according to his numbers, of any state in the union. We congratulate him for that, but making sure that going forward we'll have the infrastructure of testing all across America to deal with the coronavirus should it return in the future. With that, let me bid you all a good evening. We will be back tomorrow. And,
Vice President, I just have a question about these cartridges and this timeline, because the New Hampshire governor says the federal government is in charge of distributing those, FEMA is. So what is the timeline for when they'll have enough of them? Because they say they don't have enough, Illinois said they didn't have enough. So look, what's the timeline that you're working with?
Yeah, let me let Dr. Birx address that, but there was an initial tranche that we purchased. There's some 18,000 Abbott Laboratory machines around the country. And FEMA acquired a certain amount that were immediately distributed across the states. But now Abbott Laboratories is literally producing some 50,000 a day. Those are available on the open market. And we're also going to be working with Abbott and with the states to deploy those resources. And we're also working with other manufacturers to increase the production of cartridges. But if there's more to that you want to
No,
add,
that was
Deb, we'll make it the
perfectly
last.
said. I just want to, sometimes you ask these questions, and I just want to make sure that people understand. So a third of them went specifically to Indian Health Service and these states that have smaller epidemics. 2/3 of it went into the public market, mostly targeted to the places where there's high disease. But only 2/3 went that way so that people could purchase them directly, and 1/3 went to the Indian Health Service and to the smaller states that really need these. And so I think what we're trying to do now is balance the entire testing framework of medium, low, and high throughput machines to give everyone the maximum flexibility state by state based on what the needs are at that moment. If there's an outbreak and you have to do 5,000 tests, you're not going to do them on an ID Now machine that takes 15 minutes for every negative, but you're going to do it on your high throughput machine. So making sure everybody knows where everything is and what is being run will be really critical moving forward, because we can't leave anything not on, everything has to be on the table in order for us to be able to dramatically increase testing. Yet another, we went up by a log in 3 weeks. So if we're going to increase again, it's going to have to be getting every piece of equipment on.